going to give you an update on what we're doing in Florida for COVID-19. We were granted the FEMA disaster declaration by the president today. That obviously opens up more federal funds for us, which we're very appreciative. Some other states have received it, but we're glad that we were able to get that going. The main orders that are coming out today relate to the senior citizens and those with significant medical issues to stay at home. The Surgeon General is going to issue that. That is statewide. And so if you're 65 or older, or if you have a serious underlying condition, such as serious heart conditions, chronic lung disease, if you have some problems with your immune system, regardless of where you are in the state, stay at home, and let's let everyone work on this and be very careful who you're coming in contact with. The numbers that we have as we've expanded testing, the data is just overwhelming that if you're not in one of those two groups, your chance of suffering a fatality is extremely, extremely low. And so we have a special obligation to protect the groups of folks who are more elderly and those who have serious medical conditions. But it's not just if you're elderly with a serious medical condition. We have seen people who are less than 65 who have significant conditions get infected and then suffer fatalities. But, the data is interesting. Miami-Dade, we've started ramping up testing there. They lead the state. There's 400 infections there. As of today, there's been 0 fatalities in Miami-Dade. And so it gives you a sense of where this will potentially end up. And so getting this more information is very, very important. And then we're also doing the telecommuting guidance, reiterating that. The workforce gets to 50% for private businesses, and the rest can telework. And then, the gatherings, regardless of where you are, it's less important on where you are than just are you with a group of people. And the statewide, we need to be following the CDC's guidance of 10 folks for a gathering. We came out, as many of you know, on the travel that's coming out of New York City. I did an order yesterday that people that are leaving the tri-state area should be self-isolating for a period of 14 days. And I'm really pleased that the federal government, the White House, the task force has reiterated that guidance. I mean, the fact of the matter is, you look around the country, there are different spots. New York City is the epicenter. I think they have a huge percentage of the total cases in our country. And so and this has certainly been circulating there for weeks and weeks at a minimum. So people that are leaving that tri-state area, coming to really anywhere, but to Florida, need to self-isolate. So if you came last week, you need to self-isolate for 14 days, and you need to reach out to any contacts you have in Florida, close contacts that you have been in contact with, and let them know that you're coming from New York. We actually had the National Guard at the check-in for the flights coming in. We're only doing the flights from the New York City area, and they're coming in. Everyone's getting processed. And that information is going to be shared with the various regions. So if you fly into Miami and you're going out to Miami Beach, then we're going to let those folks know that you're there, just so we can make sure that people are being kept safe. And if you're somebody that left, you left. If you were in New York State, you left when you were told to shelter in place. You defied that, and then you got on a plane and came here. And so we don't want there to be any fallout here in the state of Florida from that. So I'm really glad that that's happened. What we're going to do, we have a contract now with one of the Google apps. So we're going to be able to make this digital very soon. I told the Department of Health to go forward with it, but that'll make it even easier for us to do. But I'll tell you, these flights, I mean, it's just unbelievable. You look, 150, 180, 200, 167 flights a day ever since that stay-at-home order was issued. People are just getting out of Dodge. I know Florida is probably the #1 destination, but we're probably not the only destination for people fleeing New York. And it's just the type of thing. If you can't get a flight from Milan to Florida, you can't get a flight from China to Florida or anywhere in the country, but somehow you can just do 200 flights, direct flights into various parts of Florida from a hotspot that's much more significant right now than Milan or than China. And so we've got to take precautions here. But I thank the White House for reiterating what we wanted to do. We're also constantly monitoring and making arrangements for the need for any bed space. Right now, We have a 35% capacity statewide for bed space, and ICU adult capacity about 33%. There are 24 ICU beds that opened up in Broward yesterday. So these are things that the Department of Health and ACA are monitoring. But when I did the order to stop the elective surgeries, that has now opened up more of the ICU bed space and other bed space. We also spoke with the Army Corps of Engineers. We spoke with FEMA. As you know, we've already made contingencies with the field hospital. We've identified other buildings. They want to be there in case, we see that surge. So far, even as we've expanded testing, we're actually seeing an increase in available bed space. We're not seeing the hospitals fill up, but that's something that we obviously want to be ready for. I went today to Orlando at the State Logistics Response Center. As many of you know, this is a very logistics-heavy response because you need the N95 masks, you need collection swabs, you need all these things to be able to effectively do it. There's never been a stronger crunch for this stuff than right now worldwide, but certainly in the United States. That facility for us is 24/7. As we get masks in, they're going to be pushed out to the counties, and then the counties can work. Do the law enforcement need it? Do the hospitals need it? Whoever needs it, we want to get that PPE in their hands as quickly as possible. I've spoke with both the White House and FEMA about these collection swabs. We have the ability to run a lot of tests, but you got to be able to get the sample. There's a big crush on that right now. So we're just continuing to do it. We've greatly expanded the testing capacity, but we want to be able to do more because I think people want to know if they have symptoms. It really, 90% come back negative, but that's good for them if they know that they're negative, and it's obviously good for us to get a sense of how this virus is moving around the state of Florida. So I want to thank Jared Moskowitz for all he's doing. And we also had the Orange County Convention Center site open today. So we have the National Guard doing it. That is with a lot of the federal supplies that were brought in. So they're able to process only 250 a day. We apologize, we can't do more, but that's just the federal rule for this site. So we want to work as many tests in Central Florida as we can, and I think that that'll be a good thing. And then, of course, we have the Dade County, Broward, Jacksonville, and then a lot of the hospitals have done great things. And so this has really been a big effort statewide from going, to the beginning of the month when CDC, we just said send it all to Atlanta. And when all that stuff didn't really work out, everyone's really sprung into action under very difficult constraints to be able to advance more testing. But I really want to thank the National Guard. I mean, their involvement in these test centers has made them run well. A lot of these test centers throughout the country were big failures. If you look at what they did in Broward, soup to nuts, they're putting through 800 people, I think, a day almost there. Really, really incredible stuff. So I want to thank our guardsmen. And we continue to keep up the fight. So I want to thank everyone who's involved in it and thank everyone who's working so hard. And with that, I'll take some questions.
So the president has gotten mixed reactions on this, and I know you guys are close. I believe you've had conversations with them. How do you rate how he's handled this, and what has been positive as far as what he's doing for Florida? And are there any issues that you wish he could be doing more?
No, I think he's been great for us. I mean, I think that he has had more attention on other areas simply because those other areas have flared up more than Florida. And so I can't fault him for that. But he's been a heck of an ally to us across the board. Look, when you deal with this, what I think the president is able to do is overcome the bureaucracy. Any response with the federal bureaucracy, there's going to be problems. And that was true here with CDC. There's been true with FDA. And he really works hard to overcome that, which is very good. When you're in a situation like this, we cannot be paralyzed by bureaucratic rules. I think the president understands that. So we really appreciate his support and the task force. I mean, you have a lot of people there who are working very, very hard. And they're not getting a lot of sleep. And they're really focusing on a big country that we have, and from Dr. Birx to Dr. Fauci to the vice president who's worked very hard, the Surgeon General, they are really doing a good job. It's a tough situation, but they're working hard.
Well, Governor, yesterday he said, the president said that he'd like to see the country open back up essentially by Easter. Is that a realistic timeline, at least for Florida?
So I've heard it reported that Trump wants to ditch social distancing by Easter. And here's the thing, I don't think that's what he said. I think what he said is you don't want massive lockouts, but that does not mean you don't have social distancing. We are going to continue to have society respond to be able to fight this virus. There is no chance we're just going to say the hell with it and not even worry about it. That is going to be a part of our daily lives until we have a solution to this. But I think what the president said, and I think what I believe is, there's ways that we can do that as a society, without thrusting people into protracted economic misery, and probably would end up in some public health challenges as well. But there's no way we're just going to walk away from any social distancing. We're learning more and more about the virus, which is great, but there's no treatment for it. Oh, maybe the thing they're talking about will work, but I mean, there's no antiviral and there's no vaccine. So we'll see how things develop. We'll see how the virus is able to move through society, how well it can. But we're going to continue to do some level of social distancing. But I think that there's ways you can do that and still have a society that is doing more than simply, on lockdown. Mike?
Governor, is it acceptable to you if more than 50% of a state agency could telecommute, that the agency head could allow more?
Sure. Oh, yeah, absolutely. As much as they can, we're 100% on board with the telecommuting. And, in Florida, to the extent that is going to make a huge, we've pushed it, but what I've learned is when people do these guidelines, a lot of times they do it with like a real big urban center in mind. And so in like a New York City, not getting on the subway, that's a huge thing for avoiding close contact because you're packed in. DC Metro, things like that. Here most people drive in, and so the contact is different. But I still think to the extent that they can do it and people stay at home, we want to empower them and support that.
The rate of the increase of infections in Florida, Governor, is doubling pretty much every 3 days in line with what's been happening up in New York. When do you expect the apex to hit here in Florida?
I don't think we know, and the reason is because we don't know the baseline that we're working off of. We know when testing started to ramp up, but we don't know how this virus was introduced to Florida. There are people that I talk to that say, I had a nasty bug in January. It wasn't the flu. I didn't know what the heck it was. And if you think about it, anything that would happen in China in November is definitely going to end up in California pretty soon after that, and New York. And then Florida would probably be the third place with all the international travel that we have. So we don't know the baseline to know whether the total infections in the population are increasing at a certain rate or whether that's just what we're documenting. I think that the thing that we look at is what are the fatalities from this? And if you have 400 infections in Dade but no fatalities, to me, that's a positive thing. I'd rather have 400 infections, no fatalities, than have 200 infections and 5 fatalities. I mean, that should just be reducing fatalities, preventing them as best we can, and then the hospitalization. So that's really what you're looking at. So we've expanded testing dramatically in places like Broward and Miami-Dade. So you are seeing more there, but we totally expected that. And we think we'll continue to see more because, when we started the Broward station, that was 700 tests a day. And I think it's been going on that way pretty steady for the last 4 or 5 days. So that's a lot of data. If you go back just a week and a half ago, we were looking at much less in terms of test results.
And Governor, how much of the state's reserves have you had to rely on to combat COVID-19? And do you see a scenario where you call lawmakers back to Tallahassee to make reductions?
So I don't think this is really going to end up affecting the budget because I think what's going to happen is we're going to get the reimbursements from the federal government. I think this bill that's moving through, however it ends up, I think we'll end up saying what you're putting out for this, you'll have the ability to get reimbursed, not just at the state level, but at the local level as well. But I think the hit to the budget will just simply be an effect of, what happens with the economy. How does this thing turn? When does it turn? And so we're going to monitor that and see how the next few weeks turn out, and then we'll be able to make a decision on that. But I told both leaders, I'm just going to let the budget sit now. I'm not going to start vetoing everything. I'm not going to sign it yet. Let's see where we are. Let's see kind of how this situation unfolds. This is a constant thing where you're reassessing everything and then we'll go from there. But I am confident on this. I think we're going to get a significant amount of support in terms of the federal government. Yes, sir.
So DEO's got some issues right now with unemployment claims. They've had trouble with big call volumes. They've got a website that's been struggling to help people. Obviously,
No, I mean, it's,
Director Lawson's been doing some things on his own. He's hiring more staff. He's trying to boost server capacity. Is there anything more that the state needs to do to jump in?
I told Ken, obviously you got to ramp up. And it was before this, we had such a embarrassment of riches with our unemployment rate. And I remember him coming to me one time and said, Governor, I have some of these employees. We don't have enough claims to fill, but, they're going to be kind of just attritioning out. I'd rather let that happen than just fire everyone at once. And I was like, yeah, that's fine. I get it. But just think about what a different world that was, where the agency was overstaffed. Just a few weeks ago, probably from what the claims were. Now we're in a different situation. So I've given him the go-ahead to ramp things up. This is a very sudden increase, of course, in terms of what we're looking at here, but he is doing it. And, I know I haven't gotten the numbers from yesterday, but, we're looking at going from a state that was, one day it'd be 500, then 1,000, then 250, to now a state where you're seeing 15 and 20,000 a day that are going to apply for unemployment. And I also think, once we get through this 15 days, what does the next part of the strategy look like? I think that'll be very important for these unemployment numbers because there's certain things that certain ways you can go about it that potentially could alleviate some of the problems here. There's other ways where that may exacerbate these, and I'm not saying that's the only consideration, but I think that will be key to try to determine how deep this is going to be and how long lasting it's going to be.
So I noticed
Yes, sir.
that in addition to the budget, the legislature also sent you something like 210 pieces of legislation. How are you balancing, dealing with this crisis, also dealing with those, and does this crisis change your opinion on any particular piece of legislation, or maybe any in particular, more important now than ever due to what we're facing?
So I could tell you that since probably, we were dealing with this in January. It was more monitoring. We started to see people come back. We tested people who were coming back from the regions, no cases for a while. But barely since the beginning of this month, my office has been 24/7 on COVID-19. I'm putting off the Supreme Court for a while. We're doing, the bills are going to be held. We are going to get to those in due time, but I think it would probably not be a good use of my time to be going through a lot of the legislation right now. If there's something in that stack of bills that would be effective immediately, that would help things, that would be different. But the stuff that's effective July 1st, I've asked them to just hold it. Let's continue doing this. We didn't know the situation would be in. There were some people saying first week of March that, the states, 10 days from now, no one will have any hospital space. So you just, this is a situation where people, are projecting things, you're looking at things. Nobody really knows. We're trying to do the best we can. So we're going to wait to see on that. And, but I don't know substantively on the major things we did. If you look at the water quality bill, really historic bill, very proud of that to help the environment. If you look at the teacher compensation, obviously we put a lot into that, and we'll see what happens with the budget. But I think that's important. We did the occupational licensing. We did E-Verify and workforce verification. That could actually be something that's even more important now, given that people are going to be needing jobs. And then we did the occupational licensing reform. So it was a really home run session, probably even better than the last one. But, it's like as that session was coming to an end, this was the world. And so we've been just focused on this issue.
Did you just say that the teacher raises were in jeopardy?
No, I didn't say it's in jeopardy. But I've said before, that would not be where I would want to go. But, look, I think the budget is in flux. Let's just put it that way. So I'm not going to go do a signing ceremony tomorrow about any of this stuff until we kind of get our feet under us a little bit more.
One more
So I
question.
noticed, oh, sorry.
But I'll do both of you. Go ahead.
Okay. I noticed you're almost out of hand sanitizer.
No, but my wife got me these. I don't know if you guys have ever seen it. It's not quite as greasy, so you kind of just do it. It's fresh, and you do it. So that's kind of on my desk, but these are the ones that we did. I think because these aren't what people look for, and so Amazon was able to deliver these. So Durasan, I don't know where it comes from, but it's pretty good stuff.
Well, will I assume that you're going to be supplied? Has the state done anything for the state workers who are showing up to work that may need hand sanitizer, toilet paper, other supplies?
Well, we can ask and figure out what's been done. I know that there's cool things going on in Florida. Bacardi is doing hand sanitizer, so you see people working. So I think it's important, and it's interesting. You look at all these studies about what can be done to stop a viral infection in this, and we do things like close restaurants, all these things. The thing that is the most effective is real good attention to hygiene, and then just keeping the social distance, so where you're not constantly on top of one another. And so I think it's really important to promote it, but I think people really do care about it now, and so this is something that will potentially save healthcare costs and other illnesses, because I think you'll have less flu and less other infections. One more.
Governor, a lot of people are just sort of angsty and uncertain about where the end is. What do you need to see either in the data or otherwise to say, okay, people can go to restaurants, people can gather more than 10? Is it like 0 cases in a row, 2 days, 3 days?
I don't know that there's going to be any pain. I think you just gotta see how it unfolds. I mean, obviously if the fatalities peter out, that's a huge thing. And I'm not saying that we're at that point, so don't get me wrong. In fact, there's just no way we're not going to see more infections and, unfortunately, more negative outcomes just from the influx, of what we've seen in New York. I mean, that's tens of thousands of people on all those flights pouring in here. And, not all of them have it, obviously, but even if a small number do and then are seeding here, if they're not self-isolating, you're going to see that effect. But, I think it's just something that we'll evolve into. But I think our guidance, with the statewide stay at home for the 65 plus and for those with significant medical issues, if those folks heed that and, just assume people you come in contact with may be infected, and so you don't want to come in that 6-foot radius where you could potentially catch the infection. If they're doing that, then they're protecting themselves. And then if other folks in society are respecting that and understanding, hey, it's probably not the best thing in the world to send a 23-year-old grandson in well, they can't get in the nursing home now because of our rules. But if you have a senior who's living alone to do that, just now's the time. You just got to kind of use better judgment. Let's see how this thing plays out. But we know enough about the data to know the people that we need to be protecting. And so that's a good thing about this, in the sense of, the Spanish flu would just taking out all the soldiers. So these are people in their 20, 25, healthy, not a care in the world. They get the Spanish flu, they'd be off their rocker, and many of them didn't make it at all. This one the target is a more identifiable class. So that allows us, I think, potentially to build some society-wide social distancing, and I think that would apply for business, that would apply for other types of things. I'm not sure when you're going to see like large-scale sporting events, but I think some of these other things, I think you probably could figure out ways to make accommodations and make it do good. So, well, thank you guys, and we'll have more updates tomorrow.